Hello and welcome to another Pause for Thought from petcpd.com. In this episode, I want to talk about pain. I want to talk about why I call pain the Great Deceiver, and most importantly, what that means for your dogs and for you. I've divided this blog into 4 broad sections. In section 1, I start with a human story to set the scene and a story about a dog. Then in the second section, I explain why I call pain the four-faced Great Deceiver. In section 3, I'll give you a very brief run through of how pain pulls off this great deception. Finally, and most importantly, in section 4, I'll give you some pointers for the kinds of things that you can do to make sure that your dog does not fall victim to this horrible disease and lives a long and happy and fulfilled life with you and your family. Section 1. Putting pain into context. Meet Penny. In 1998, Penny was treated for breast cancer, but in February 2016, the cancer came back again. Penny had more surgery and chemotherapy, but unfortunately, the cancer had spread to her lungs. This is a true story, but of course, names and personal details have been changed to protect Penny's identity. To start with, Penny could manage the pain with over-the-counter painkillers such as paracetamol. But by the end of June 2016, the pain had become unbearable for her. Penny describes her pain like this. It feels like someone's sticking a hot knife through my chest and into the chair behind me. The pain is terrible. It spreads out like a paralyzing cramp, which makes it very hard to move. As time went by, Penny's spasms of pain got worse and more frequent, and she was unable to sleep. Despite her pleas for help, Penny's doctor just kept telling her to take a couple of paracetamol. Penny's experience and her doctor's reluctance to get to grips with her pain is actually quite common in the medical profession. There are 2 reasons for this. The first reason is that patients commonly underplay the amount of pain that they are experiencing because they don't want to make a fuss, or they find it difficult to describe their pain to the doctor during a busy clinic. The second reason is the reluctance of the medical profession to prescribe strong pain relief medications such as opioids because of the opioid crisis and addiction epidemic in humans all over the world. I use Penny's example here to make the point of how difficult pain can be to diagnose, even in humans where we can explain in great detail to our doctor where our pain is and what it feels like and how it is adversely affecting our quality of life. In contrast, our dogs simply can't have such a detailed conversation with us or with our vets. They simply can't explain how their pain feels to them like we can. This is why it's impossible to rule out pain in a physical examination at the vets, especially in a quick 10 or 20-minute consultation. Dogs are non-verbal. You can't ask them how they feel and expect them to explain complex internal feeling states, especially complex pain states like Penny's. The best we humans can do is to rely on the dog's behaviour. The problem with relying on observing behaviour is that dogs are often frightened at the veterinary surgery, and when they're frightened they become very stoical and hide how they are feeling inside. Section 2. Why pain is the four-faced Great Deceiver. Imagine you're out walking with your dogs. They're both having a fantastic time, running around, following smells, chasing birds, digging holes, and swimming and rolling in muddy puddles. Then one of your dogs comes up lame in the right front paw. You investigate and she's broken a nail. And this is where we need to be aware of the first of pain's 4 faces of deception. Here's the thing. If your dog's broken nail is not managed properly and treated properly and the limp persists, then the limp that she has today, which we call acute pain, is going to be a very different kind of limp from the limp that she will have in 2 weeks' time, which we call chronic pain. The absolutely critical point here is the difference between acute pain and chronic pain. This is one of pain's great deceptions. Pain can morph from one kind of normal physiological state to a very different kind of abnormal pathological state. And the crucial point here is that both limps look exactly the same from the outside. There is no way that you, the owner, or your vet, can tell the difference. So although the limp hasn't changed at all in its appearance over 2 weeks, what has actually happened on the inside is very different, and it's a sinister story. Here's a real case example. This wee dog broke her toenail and it wasn't managed properly. It subsequently became infected, the infection got into the bone, and the disease eventually led to severe arthritis in her toe. We had to amputate her toe so she could walk properly and pain-free again. I mention this because this transition of pain from normal to abnormal is exactly what happens in age-related osteoarthritis in dogs, which is the most common pain-related chronic disease and has a huge impact on canine welfare. But if managed properly early on, you can do a lot to help your dog avoid the worst aspects of this horrible and life-changing disease. Pain is unlike any other sense. It only gets worse. Imagine you're on holiday and you're caught short and you have to use one of these. It's cold, it's wet, it's clammy, and it stinks. But give it a few minutes and you start to habituate. You become less aware of all that discomfort and stink. Basically, what has happened is that the signals being sent up to your brain by your touch receptors, cold receptors, and pressure receptors in your backside have compensated for the unpleasant sensory information that you are feeling. Same thing happens with your sense of smell. The big problem with pain is this. Although superficially, pain works just like the other senses, such as touch and pressure, the big difference is that, unlike the other senses, pain does not habituate to the pain stimuli in the same way that the sensation of touch habituates to touch stimuli. In fact, it only gets worse. The other way, it becomes more sensitized. So if you had the misfortune of having a painful sore on your backside and you had to use this very uncomfortable toilet, unlike the sensations of touch, temperature and pressure, your pain receptors and pain pathways would be activated and you would feel more pain as you sat there doing your business. This is why, when pain is not managed properly early on and it morphs into maladaptive pain, you are at risk of developing conditions like this. This is called allodynia, where the normal sensory signals being sent to your brain by your receptors for touch, pressure, temperature and so on are hijacked and recruited as pain signals by the pain pathways. Chronic maladaptive pain can turn ordinary gentle touch, such as a hug, into a painful experience for a dog. Many humans suffer from this invisible but horrible condition as well. It may have even affected you. I need to point out here that this dog does not have allodynia. I'm using this image for illustrative purposes only, with permission of course from the owner. Here's another really common human story for you. Both these women are in hospital and both have exactly the same level of pain. The only difference between these two women is that for Alison, her severe pain is caused by complicated delivery during childbirth, but for Vanessa, her pain is the result of terminal cancer in her uterus. And this common scenario raises an important question. Which of these two women feels more pain and which of these two women is suffering more? This simple concept is so important for animal welfare, I could spend a whole weekend talking to you about it and still have more left over to say. But the point I want to get across here is that pain is very much an emotional experience which far outweighs its importance and significance as a physical process. In other words, pain and suffering is felt in the brain, so it is whatever the patient or the dog says it is. Pain is very much an emotional experience in exactly the same way that other familiar feeling states such as fear, loneliness, love and happiness are emotional experiences. This is why pain has such hugely significant welfare implications for both dogs and humans, and I'll come back to this vitally important fact a little later on. And because pain is an emotional disease, not a physical one, it destroys mental health, it destroys lives, and as a consequence of that, it destroys the economy too. In 2017, I was invited to speak at a two-day conference at the Royal Society of Medicine in London, with the rather grand title of Functional Symptoms in Neurology and Psychiatry. The topic I was given to speak about was on the placebo effect in animals. Now, I'm not talking about the placebo effect in this vlog, but the seminar itself really opened my eyes to a whole new area of pain in humans, where it has an absolutely devastating and lifelong negative effect on the lives of millions of people all over the world. The numbers and costs are just staggering. Of all of you that have watched this video blog, somewhere between 1 in 10 and 1 in 30 of you in the UK will be under treatment by your doctor for an undiagnosed chronic health condition. And for about 50% of those, you will have been suffering for up to 10 years. The vast majority of these horrible and debilitating diseases are related to chronic pain. In the United States, the economic impact of these kinds of complicated and chronic diseases runs at around $250 billion a year. That's $250 billion a year. Now remember, these numbers don't include all those people who suffer from identifiable chronic pain conditions. These are shocking figures for the human population, but I hope it does give you some idea of why I call chronic disease the Great Deceiver. And what about dogs? We have no comparable figures for dogs of hidden or undiagnosable pain conditions. As I said earlier, the lack of data comes about because it's just impossible to ask a dog to describe her symptoms. Dogs are not equipped with verbal report like humans are, and relying on signs such as changes in behaviour or temperament are simply not reliable enough. Put simply, dogs just can't tell us that they are in pain and where that pain is, like we humans can. But we do have some data on the prevalence of diagnosed chronic pain in dogs. Of all the chronic pain conditions in dogs, osteoarthritis is by far the most common, with a prevalence of around 20% of middle-aged to old-age dogs. That means that around 1 in 5 dogs of 5 years old or older are very likely to have significant osteoarthritis in one or more of their joints. Some recent data published in the UK showed that between 2012 and 2015 there was a 3-fold increase in the number of dogs being identified with osteoarthritis. Section 3. The Great Deceiver in action. Right, I hope we all agree now that pain is felt, experienced in the brain, and it is whatever the dog says it is. But a simple but vitally important misconception here is that the pain signals simply pass up through the nerves from the dog's foot to her brain, like I've shown with the red line in this diagram. A direct connection, like the electric cord you use to charge your smartphone with. But I'm sure that by now you've guessed that it is a lot more complicated than that. There are, in fact, 5 separate processes or junctions that are involved in conveying a pain signal from a dog's injured toenail up into the dog's brain where the sensation of pain is experienced. And this same plan is the same for pain anywhere in the body. And this is vitally important to know because as pain morphs from acute adaptive pain into chronic maladaptive pain, it is at each of these junctions, here labelled as 1 to 5, that amplification and distortion of pain signals can occur. And to press home the point I'm trying to make here, I've represented this here with the graphic of volume controls and the amplitude of the pain signals and the stop and go signs. This modulation of a pain signal occurs at all 5 junctions. One other point to mention here is that the brain also modulates the pain signals it receives by communicating with the nerves at junction 3 in this diagram. This modulation can be up or down, more pain or less, and this depends on the dog's emotional state. Negative emotional states, such as fear and separation anxiety, turn up the pain volume. On the other hand, positive emotional states tend to turn down the pain volume. This is exactly why Alison, the woman having a baby, experienced less pain than Vanessa, the woman with terminal cancer. So all in all, you can see that this is a really complicated system, and there is still a great deal we simply don't know enough about. What I'm going to do now is just tease out some of the most important points about how these pain pathways work and why this is important. And I'll use the dog with the broken nail that I started with to illustrate what's going on with the pain signals at each junction. Junction 1. The first thing that happens with an injury is that the surrounding cells release a whole cocktail of inflammatory chemicals, and that's what causes the initial redness and swelling you see around an injury. Junction 2. And it is also those inflammatory chemicals which stimulate the pain receptors adjacent to the site of injury. This process is called peripheral sensitization. Both of these steps are protective, because the inflammatory chemicals alert the immune system to be on the lookout for contamination of the wound and infection, and the early pain signals alert the dog that she has an injury and calls her attention to it, and this is why she limps. Peripheral sensitization also turns up the volume of the pain signal at junction 3, which is the dorsal horn of the spinal cord, and this process is called wind-up. You'll be very familiar with peripheral sensitization and wind-up from the injuries that you've had. For example, when you prick yourself with a needle, you first experience that immediate sharp pain, the ouch. Then shortly after that, you get the red and tender swelling along with that persistent throbbing dull pain that can go on for hours. So far, I've given you a brief synopsis of what happens for simple injuries such as a broken toenail, and I describe this as acute adaptive pain. But what happens with more complicated injuries that persist and don't heal quickly in the same way that simple injuries heal? I gave you a real example of such an injury with a dog with a broken toenail, where the injury progressed into an infection and then osteoarthritis in the joints of the toe. And I also said that the pain associated with age-related osteoarthritis progresses in exactly the same way, and I called it chronic maladaptive pain. And this is where junction 3 in the dorsal horn of the spinal cord comes into play. I've drawn a fairly rough sketch of a cross-section through the spinal cord to show the anatomy of the dorsal horn, along with some of the nerve fibres that run through it to and from the brain. When the neurons in the dorsal horn are bombarded with persisting signals from the site of an injury, this causes a prolonged period of wind-up that I described earlier. Prolonged wind-up inevitably leads to another process called central sensitization. Central sensitization is abnormal, and it is responsible for the amplification and distortion of pain signals being transmitted up to the brain. Central sensitization can be permanent and is often very difficult to treat and manage. However, if complex injuries are managed early on, then central sensitization can be prevented, and I'll talk about that in the next section. Finally, what happens at junctions 4 and 5? As I've said several times already, pain is better characterized as an emotional state, and as such, long-standing pain conditions are intimately linked with long-standing mental health issues, not just in humans, but in dogs too. Long-standing pain causes substantial release of stress hormones, such as cortisol and adrenaline, and this in turn leads to long-standing stress and anxiety. Anxiety has an enormous impact on mood state, and it leads to conditions such as depression. You'll find a lot more information about the link between pain and behavioural problems in dogs on my website at www.petcpd.com. If you look in the categories section and click on the Pause for Thought link, you'll find a video blog about this called The Startling Science of Fear and Love, where I discuss how pain can be involved in behavioural problems such as fear, separation anxiety and aggression. You'll also find additional resources about pain scattered across the website. Section 4. What can you do to help your dog defeat the Great Deceiver? If you remember nothing else about what I've said in this video blog, do remember this. Chronic pain is not acute pain that has lasted a long time. This is why the term adaptive pain is a much more accurate term for acute pain, and the term maladaptive pain is a much more accurate term for chronic pain. Finally, if your dog suffers from a lifelong painful disease such as osteoarthritis, one of the best online resources that can help you here is Canine Arthritis Management, and you can see the web address on the screen. The most important factor here in successfully treating long-standing pain diseases like osteoarthritis is an individualized pain management program, and you can see a really good example of the 8-step plan here. Ongoing pain diseases such as osteoarthritis must be tackled using a holistic approach, and that approach must take into account all 5 junctions in the pain pathway that I have described. The reason this is so important is because this is where pain orchestrates its great deception. Your veterinarian will help you construct an individualized pain management plan that best fits your dog and the lifestyle that you lead. Let's all work together towards a pain-free world, not just for dogs, but for all animals, including us humans too, because our health and well-being is important as well. Thank you for taking the time to watch this blog. I do hope you enjoyed it and found it useful. You can of course find lots of other resources at www.petcpd.com, and do keep checking back for updates because I'm adding new material all the time. Take care and keep safe.